There we go. All right. I'd like to welcome everybody today to the July. I was thinking today, boy, how did it get to be July already? The July webinar, Mid-Atlantic webinar series. So I want to thank everybody who keeps showing up month after month. And as always, I am open for suggestions on what kind of webinars you'd like to see. Today, our webinar is Introduction to Home Care for Patients with ALS, and it's going to be done by the Maxim Healthcare team. I'll let them do a brief introduction in a second, but I just sort of wanted to give you an overview. So what they're going to be talking about is like what kinds of services are offered, what kind of questions to ask, and this is a big one for me, what kind of questions to ask when you're looking for home care, what kind of things to look for, what's the difference between skilled and non-skilled nursing, what you have to do to get those two, and the payment system. So what I want to point out, mine is at the bottom of my screen. After we finish all of this, we're going to have a question and answer session. So if you have questions anytime throughout this, just find that Q&A. Like I say, mine's at the bottom of the screen. Sometimes some people tell me it's at the bar at the top, and just plug into that. And after the presentation, what I'll do is we are going to answer as many questions as we can. So I'm going to stop talking. I am going to put myself on mute, which probably a lot of people wish they could. And I will stop my video. I'm going to start with you, Taylor, and turn it over to you. All right?
Perfect. Sounds great. Thank you so much, everybody, for joining today's webinar on home health care services. We'll definitely have time, like Jerry spoke up at the end, to answer question answers at the end of the presentation. But my name is Taylor Black. I am the Senior Business Development Manager, and I'm out of the Silver Spring, Maryland office.
My name is Brooke. I am a Recruitment Operations Manager, and I work out of the Baltimore office.
Something's happened. Hi.
Brooke, Taylor, you are muted.
I can't hear you.
Who's speaking, but you're muted. Yep, you're still muted.
Can you hear me now?
There you go. There you go.
Perfect. Chris and Alyssa, did you go yet?
Oh, sorry. Yeah. So, hi, everyone. My name is Alyssa Battle Reed, and I am the Operations Manager for the Millersville Home Care Office.
Hello, everyone. My name is Chris DeCane. I'm a Senior Business Development Manager as well, and I work out of our Northern Virginia office located in Falls Church.
All right, perfect. So we'll go ahead and get started. Let's share my screen. Okay. Here's everybody's lovely pictures. All right. For today's agenda, we'll be going over home health care services, home health care admission criteria, who can and will pay for home care services, questions to ask the home care provider, what to expect upon admission, and then we'll go over question and answers. So for home health care services, benefits of having home health care is quality of care in the comfort of your home, increased freedom and independence, family caregiver support, reduce hospitalization admissions, and reduce infection risks from staying home and outside of the medical facilities. So now I'm going to talk about unskilled level home health care services. These services are provided by a certified or non-certified nursing assistant and a home health aide. Hours can vary based on insurance. Usually it's between 6 to 8 hours a day is most common that we see for approval. And these provides assistance for you and your loved ones for activities of daily living. And this is for bathing and grooming, mobility, feeding, toileting, And then there's also instrumental activities of daily living for cleaning, laundry, and medication reminders. And these companion and respite services are provided for families to have a break needed for providing care so they can go complete their activities as well. And then now for the nursing side. So the nursing level of home care services, this starts at a broad range of services, usually between skilled and unskilled. And this is provided within the home care setting, usually with a single patient at a time. Private duty nursing refers to the long care, continuously hourly home care nursing. And then non-skilled private duty refers to 4 hours or more of continuous care that's provided by a home health aide or a certified nursing assistant to assist with those ADLs that I mentioned and the IADLs. And there's also intimate care as a nursing care, which provides episodically and regularly for limited time periods at a time. So we first have the private duty nursing, and that can be the bowel and bladder care, which has to be completed by a registered nurse in the state of Maryland and Virginia, but each state has their own rules on that. We have brain injuries, cerebral palsy, chromosomal, gastrostomy tubes, which is like G2 monitoring and feeding. That can be completed by a registered nurse or a licensed practical nurse. Muscular dystrophy, seizure monitoring, tracheostomy, and ventilator care. And then some other services are case coordination services, disease management, teaching visits, and that can help with improving loved one's self-management, infusion therapy, medication management visits. RNs will come out to help set up medication and pill boxes. Respite care, which is provided in-home services for you and your loved ones and helps offer support. Injection trainings, visiting nurses and RN assessments, and that's completed usually by the registered nurse only. Wellness, well mom and well baby visits, wound management, and these usually vary based on doctor's orders for the wound care visits. Sometimes it could be once a week, or it could be 2 to 3 times a week. And now I just want to pretty much just discuss the difference between skilled nursing and non-skilled care, unskilled nursing. The skilled nursing, this will always be completed by a registered nurse or a licensed practical nurse. And skilled nursing helps with the medical aspect, such as medication, wound care, and medical needs. And then the non-skilled, unskilled portion will always be completed by a certified or non-certified nursing assistant and a home health aide. And then non-skilled care, unskilled, assists always with everyday care and needs for the patient that are non-medical. That was previously discussed, like taking loved ones to appointments, or also helping with laundry care. And now I'm going to pass it over to Alyssa, who's going to go over the home health care admission criteria.
All right, thanks, Taylor. So home care admission criteria. These are the steps that you want that your loved one or yourself may want to review when asking yourself, okay, am I ready for home care? You want the patient is under the care of a physician. So usually the physician that's been that you've been working with, or your loved one was working with, that's going to be the same physician that's actually creating the doctor's orders for home care, for your home care services. Patient agrees to home care. The patient must agree. We can't force it on them, or no other agency can force it on them. Home environment must be adequate for safe, for effective and clinical care. And then, in fact, an emergency plan will then be created for the loved one as well, or yourself. There is a plan in place for medical emergencies. Able and willing caregiver to participate in care, meaning, like Taylor was discussing, like a nurse or certified nursing assistant or home health aide must be willing to be there. And then also the patient must have a loved one that's willing to step in when the caregiver can't be there. Adequate funding source to support patients' healthcare needs. And funding sources, and we're going to talk about more of those in detail. But funding sources can include health insurance, long-term care insurance, private pay if the family wants to come together and pay private pay for the services that are needed. And then also homebound criteria met for Medicare. Medicare has their own criteria, and for those patients or loved ones that are interested, you know, you can definitely ask those questions, and we'll go into what questions you should ask home care agencies as well. But those questions are going to be met when you're asking home care agencies, should they work with you, should you be able to work with them or not. They'll inform you about the Medicare criteria.
All right, now pass it to Chris, who will go over who will pay for healthcare.
Very good. Thank you very much, Taylor. Appreciate it. Okay, so who can and will pay for home care services? So there are many different ways and examples of who can pay for these services. Here's a breakdown of different payer sources. So Medicare does cover some services. There are different Medicaid programs, and of course that varies by state, which we'll talk a little bit about in the next slide. The VA health system, if enrolled in the Veterans Health Administration, TRICARE, different commercial insurances, which again we'll cover a little bit more in the next slide. CHAMP VA, the Civilian Health and Medical Program of the Department of Veterans Affairs, different TPAs or third-party administrators, different long-term care insurances, and as Taylor had mentioned before, and Alyssa, a private pay as well. Obviously, that's usually a last resort, right? Next slide, please. Okay, so this table breaks down different in-home care services. So homemaker or home health aid services, which is personal care or the unskilled piece that Taylor had alluded to earlier. Expanded care or private duty nursing services, skilled home health care, and skilled home health care therapies. So you'll see here that if enrolled in the Veterans Health Administration, most of these, actually all of these services are covered or can be covered. We break down Medicaid, Medicare, and different commercial payers as well. The biggest thing to note with Medicaid, and I specifically operate in Northern Virginia, so I can only speak to Virginia Medicaid. But there are different criteria that can be met, and it does vary by state. But this through Medicaid, there are different waivers that one can be enrolled in, and you can receive up to 112 hours of nursing services for the state of Virginia if certain criteria is met. For Medicare, you'll notice that for instance, expanded care or private duty nursing, that is not a covered benefit. A lot of times Medicare would step in if there are intermittent visit requests or therapy-related services that are needed. That's where Medicare comes in. For different commercial insurances, commercial insurance a lot of it varies by the insurance, but speaking specifically to, say, private duty nursing or expanded care, they have what is referred to as a private duty nursing benefit or PDN benefit. Sometimes this might be based off of medical necessity. It could be a limited benefit. It just depends. And then commercial insurances do not typically cover personal care or homemaker services. That is one important distinction that is worth highlighting. So a lot of it just depends on the particular insurance and what the plan would cover. Okay. So next slide. So veterans with ALS. So we had partnered with the National ALS Association to provide a couple of different educational handouts for veterans themselves and for their caregivers. They can be viewed, it's tough to read the small print here, but they can be reviewed if you click on the hyperlinks, and we can share those offline as well. And then we did want to just include our National Caregiver of the Year back in 2018, Sue Scott. She had worked with a patient who was a veteran with ALS that was funded by one of our local VA medical centers. Great video, not too long. I believe it's a YouTube video. Definitely neat and worth checking out.
Thank you, Chris. And now I'm going to pass it over to Brooke, who's going to go over questions to ask any home care provider.
Okay, yeah, so I'm just going to go over some important questions to ask. So number one, is your home care provider licensed? Is your home care provider accredited by a leading national firm? Are the caregivers employed by the provider regularly supervised and evaluated by the provider's clinical director or registered nurse? Does the provider perform criminal background checks on caregivers prior to hiring? Are the caregivers covered by workers' comp, even in the event that they are injured on the job? Is the provider responsible for deducting state, federal, local, and social security taxes from the caregiver's wages? Does the provider send registered nurse to meet the family and develop a plan of care for the caregivers to follow? Does the provider require the caregivers to carry photo identification? And if you are dissatisfied with your caregiver, may you request a replacement? Does the provider keep a logbook in your home to document services performed, like meals, activities, bathing? Does the provider offer overnight and or 24/7 care? And is the provider available on call 24 hours a day, 7 days a week, 365 days a year? So Maxim's answer to all these questions is yes. So when selecting a home care agency, make sure these questions get asked beforehand.
Thank you, Brooke. And back to Alyssa to go over what to expect upon admission.
All right, awesome. Thanks, Kay. So what to expect upon admission? An initial comprehensive assessment is going to be performed by RN. And that initial assessment is done prior to the nurse or the aide being able to work. That assessment must be done. I know most insurances require it to be done as well. And in some agencies, that's a requirement as well for the initial part of the start of home care services. That gives the clinical team that's working with your loved one or yourself an idea of actually what's needed. And sometimes that's the first time the clinical team is actually like putting hands on the patient or actually seeing the patient. Appropriate clinical personnel are assigned based on skill set and experience, as well as prevailing scope of service, meaning that a nurse or aide is chosen based on what's needed for the patient, what's needed for your loved one. And most agencies do perform some type of skills assessments, and you can ask, and you can even inquire, has anyone seen this nurse perform this skill set prior to us working with myself or working with our loved one? You can ask those questions as well. Patient and caregivers will be oriented to the services and administrative policies, meaning the agency should inform you on what's the policies of the services that you're being offered. And then lastly, a plan of care is developed and collaboratively by the assessing RN, the clinical director, ordering physician, patient, and caregiver. So it's a joint force of everybody working with the patient to basically say, okay, this is what the home care orders are, and this is what the plan is, so that the caregiver has a plan to follow day over day, hour over hour, while working with yourself or your loved one.
Thank you, Alyssa. All right, and the last slide here, this is the slide Living with ALS resources. These slides will be provided to Jerry, so she can have you click on the links throughout the slides. But this is just a great slide that has information on benefits of in-home health and resources for you and your loved ones when trying to pick a home care agency, or seeing if you would like to go the non-medical service route or if you need the skilled services. So it's a really good resource here. And then lastly, I just wanted to add, when choosing a home care agency, it's very important that you're working with a professional company. Like Alyssa stated, you want to make sure that you have the administration support for the home care agency, making sure that they are able to contact the insurance companies to advocate for you and your loved one. And they know that they can work with the hospital case managers and doctors to get the appropriate insurance approval information. and making sure that the company has education of knowing who to speak with at the hospital level. A lot of times you have to speak with the case managers, the social workers, and sometimes the doctors directly to obtain these necessary documentation, such as a letter of medical necessity or updated clinicals, and which is most times very timely for the insurance. Sometimes they give us a 4-day window, or sometimes it can be 24 hours. So it's just very important that the agency you pick is very educated and aware of what is needed. And that concludes our presentation. Does anybody have any questions at all? We have time now. We'll open up to the group.
All right, thank you guys so much. I do have just a few questions, maybe some comments and stuff like that, and I'll let people add their questions in. So a lot of times when folks are trying to determine what their insurance will cover, I suggest that they reach out to their insurance company and ask them, but do you all have any like keywords or phrases, or is there anything specifically they should say other than, hey, what do you all cover? Are there like buzzwords, keywords?
Of course, I can take this one since I covered the funding sources slide. So yeah, I think a key word would be, or phrase would be private duty nursing. If they're looking for nursing services and looking to see if that is covered through their commercial, say this is a commercial insurance, that would be key, because a lot of commercial insurances, they might have a PDN benefit, but they also might have a home health benefit. And a lot of times those are not synonymous with one another. So I think it's important for them to understand the distinction, and the company as well, the agency can also make that lift and support them in trying to reach out, because they would have to understand if they're looking to go through a provider, through an agency, the agency would have to submit to that insurance anyway, most likely to see if services would be covered. So that would be an instance where the agency can step in and reach out, to the insurance company to identify whether or not there is an actual PDN benefit. In our experience with, if they are say, looking to inquire about, homemaker or personal care services, almost 99, or I'd say almost 100% of the time, commercial insurances would not cover that. Depending on what we've run into a lot, at least in Northern Virginia, is that depending on who you talk to at the insurance company, they might say that it's a covered benefit. But when it comes time for the agency to actually try to get it approved or get an authorization for the service, it's denied. So I think it just depends on what service they're looking at or looking for. But I think PDN is a big one when it comes to commercial insurances, and understanding the distinction between PDN and home health care.
Okay, so I also know, I sort of know the answer to some of the questions I'm asking, but just to make sure I do know the answer. So I believe that Maxim does have skilled nursing that are skilled in respiratory, trach, and vent care.
Yes.
So what I've told people, and tell me if this is correct, not all skilled nursing agencies have that expertise, so they need to be very careful when they're looking for that level. Would you agree with me?
Yes, I would
Yes.
100% agree with you. Even with Maxim, we have partnership with Johns Hopkins for our ventilator training, where we have a nurse come out and she'll train the nurses for 4 hours, and we make them go and work with the client directly for about 8 hours before we will let them work their first shift alone.
Okay, good, very good. So, we were talking about questions to ask people and stuff like that. And one of the questions that I tell people to ask is, what happens if what happens if my caregiver isn't able to make it that day? How would they go about getting a backup caregiver, or how sort of walk me through that one?
Well, we could tell you how we do it, but that's another question that they can ask as well. What does that process looks like? That's why on like part of the admission criteria for a patient is that they must have a backup caregiver, meaning a loved one, someone home that can take the nurse or the aide's place if that does happen, or just, an emergency, that's really what most of the time it leads to, like if it's like emergency or if it's snowing or something like that. In order for that, that agency to really be able to, partner and provide quality care, a loved one must be able to take on that responsibility as well. So it's like a partnership.
Okay.
And it's also
But-
good that we have 24/7 on call. So once our office closes at 5 o'clock, we do have on call who has access to all of our nurses and knows their skill sets. So if there is a call out or if a nurse has a flat tire on the way to their job, we're able to call backup nurses to see if we can get somebody to replace them.
Right. And for us, we usually just plan, be proactive for it. Try to have a PRN nurse that has the skill set that's needed for that patient, so that we basically just being proactive and planning for it, for the emergency. And so you want to have a PRN nurse. Our agency also provides skills advancement. All nurses must have performed their skills with our clinical manager prior to going to any patient's home. So these are questions too that you want to ask as well. Have the clinical director or the clinical manager, have they seen this nurse perform this skill set? Have they worked with a nurse? And even when you're interviewing, we say a meet and greet with their caregiver, you can ask that caregiver, have you worked with someone with a similar diagnosis or with the same diagnosis?
Well, I'm going to do a pitch right now real quick to you all. I know a lot of folks will ask me, I need an agency that is well-versed in ALS. And that's a tough one. And that's what I will tell them. That's a tough one. But we also, and this is for everybody on this webinar, the ALS Association has put together a caregiver education course. And it would be great for your caregivers or your nurses and stuff. I can send you guys the information, and for everybody else on the phone call. You do it at your own pace. It just breaks it down like into the different areas and sort of gives you an insight of ALS. So I will share that with you all and the folks on the call. If you reach out to your care service coordinator, it is I think they've done a really good job on it. So I have a question that was sent to me and I promised that I would ask it. So here goes. They wanted to know if you had information on support with someone with ALS and frontal temporal lobe dementia. This person's husband is fully independent, but would benefit from companionship and interaction. So I'm thinking it obviously, well, I shouldn't say obviously. I'm thinking it would not be qualify for any kind of skilled nursing, but more almost like a companionship kind of. This is a tough one.
Yeah, that would be a tough one, honestly, because we would have to it would really start with like insurance, honestly. And then us being able to say, okay, can we get a companion, or does it have to be a CNA? And then also, what state are they living? Like here in Maryland, for our companions, they must be certified nursing assistants. But for other states, that's different. They can have an uncertified person qualify as a companion or personal care support.
Okay. So would their best bet just be reaching out to an agency to see what you could be able to do?
Yes.
Okay.
I think that's like my per se too of everything, ask questions and just call the agency and just start your research, and really figuring out what are your priorities as a family and as a patient, and then figuring out which agency meets your priorities.
Okay. Well, I am pulling up the question and answer category and I don't see any. So this is a great time. If anybody has any questions, please ask. I know we've got a group of folks that are more than willing to answer. And I'm trying to think if I had any on my 10 million pieces of paper that I've got stuff scribbled all over.
And Jerry, can I add something as well?
Of course.
I would say, like, to everyone that that has ALS or a family member or friend, really is like when you want to get to asking these questions, is you can ask as soon as possible, right? And just so that you could be proactive in your planning. especially when it comes down to, understanding insurances, because even us are still understanding, right? You might call us, call Chris, and we're going to figure it out together, because that's what we do, and that's our passion, is to help people with this, that's suffering from this disease and family. So that's why we're in this as well. So it's like, call us or call, another agency and just ask questions, because that's why we're in these roles, to do the research, to help you do the research.
Okay, thank you. Yeah. All right, we got a question. Here we go. Okay, this person says, I have federal long-term care insurance that covers in-home care. How easy is this to access for patients?
Federal long-term care insurance. So I can do my best here. To answer your question, we would probably have to look into that one, ourselves, because I guess it would probably depend, on the, I guess the long-term care insurance. In my experience, we haven't worked all that much with long-term care insurances, so that's one that I would probably have to take a deeper dive into and try to find out and contact someone about. So I guess a non-answer, but I can try to find out for you.
All right, anybody else got anything?
And
Hey, can
that's
you all hear
exactly
me?
how it starts.
Yes, I can hear somebody.
Hi, Jerry. This is Jason Passabet. I'm on the Maxing team as well. I actually know you from years and years ago, Jerry.
Yeah.
And I'd be on video, but I'm in the middle of a broken down car with a couple babies. But I did hear the question, so I thought I'd try to give an answer. So long-term care insurance, the federal part throws me off. So I'm not quite sure, maybe clarifying what that is. But long-term care insurance, there's different kind of, I'm gonna say, quirks to it. One of the things with long-term care insurance is there's typically an elimination period where somebody has to pay out of pocket for like 30 to 90 days, and then the policy kicks in. So it would be somebody paying privately and then jumps in afterwards. And typically with long-term care insurance plans, there is usually like a daily limit, like a maximum benefit, for example, like a couple $100 or whatever it ends up being. And that will help determine exactly how much coverage that plan will provide if somebody meets all the criteria. So I guess my suggestion for anybody with long-term care insurance is find out, if you have an elimination period, what that looks like, and then find out what your daily cap is as far as the amount of money that's available. And that should give you an idea kind of where to start with the home care company. And from that point, anybody like us can fill in those blanks with what we can do, what we can't do.
Okay, thank you. Thank you.
Thank you.
So I have another question. What is the average hourly rate for in-home care in Maryland?
Like for bill rate, that's what they're asking us.
Right.
I think it's private pay rate,
what-
Lisa.
I'm
private-
sorry, I didn't mean to interrupt.
Oh, there you go, Jerry. I was just telling Alyssa, I think that they're asking for what our private pay rate would be, is what I think being asked.
I think like what they would pay
so-
per hour.
Okay. So we usually stick with the rates that are the least that we can for bill for, and that's our the Medicaid rates. So it's about $47.
Yeah, what she asked, yeah, what they would pay. So around
Right.
$47, okay.
Yeah, that's
Okay.
the minimum.
And is that for,
That's sorry. I gave you the rate for skilled services.
okay,
For unskilled, it's 27.
okay. So,
And if I could, Jerry, too, and keep in mind, I'm probably jumping over some of the other people in the group, but that varies on location, varies based on complexity level of the person. Really, what Alyssa said at the beginning was, I think, the most important part is we're going to do our best to charge the least we can to people and be able to provide a qualified caregiver or caregivers. So it really kind of changes agency to agency, patient to patient, area to area, unfortunately. But yeah, that kind of give you a good baseline.
and I'm assuming that someone with trach and vent care would be more than someone who just a skilled nurse. I shouldn't say just a skilled nurse. Not fair. skilled nurse.
But we also have recruiters that do proactive recruiting. So it was really about just finding a caregiver. You know, we might find someone that maybe just lives close to the patient, maybe live about 5 minutes away, and it's like, oh, this works out for me. You know, they might not inquire for, you know, a hefty pay rate. So it really just varies. You know, it really does.
Okay.
But we also like keep it open and communicate. But you know, Medicaid rates are public information, and that's why we try to stay somewhere near that, because we know that it could get really expensive, you know, over time. And we don't want to, you know, add another burden to the family.
Mhm. So I have someone, and I can answer this one, y'all. I have someone that says presenters are from outside of Southeast Virginia. What is the presence in the Tidewater area? So there are several maxims. There's one in Virginia Beach. There's one in Yorktown. I think there's one in the Richmond area. They have a pretty big presence in what is my territory.
Yeah.
Yeah. So, and then someone said, can we obtain a copy of the slides? And if so, how? I know y'all are going to send the slides to me.
Yes, I'll email.
I will share them with all of the care service coordinators, so they will have them. So if you'll reach out to your care service coordinator and say, hey, you know, when Jerry sends the slides, or when you get the slides, shoot them out to me. And that's probably the best way to do it. So let me mark that I've answered these so I don't ask the same question twice. So here we have someone that says, do agencies have a minimum of hours in one setting? Can an agency send someone 2 hours in the morning, 2 hours in the evening for getting patient up in the morning and ready for bed at night?
So I know we usually do have a minimum, I believe, of 4 to 5 hours usually. And that's for the unskilled side. For the skilled side is usually closer to that 7-8 hour minimum, because a lot of our nurses are looking for 40 hours a week, and it's just harder to get a nurse, you know, to go out there for 2 hours. Sometimes the 2 hours can be considered a visit. So it depends if the insurance did approve them for visits, and that's usually 1 to 2 hours, then that could be appropriate for them to go out and help. But that's only for skilled care. Usually for unskilled, it's always a 4 hour minimum for the state of Maryland. Yeah.
Okay. And I believe that's the same. That's what I've heard for Virginia also. So this person asked, is there a minimum amount of hours? And that was just answered. So.
And of course, too, Jerry, I'll just add that it depends on the provider too, right? So we're speaking specifically from, you know, our experience with Maxim, but there are other providers that very well might be able to accommodate that. It just kind of depends. Typically in like speaking for Virginia, we typically don't do split shifts just because it can be extremely challenging to staff. But there are other providers out there that very well may be able to accommodate. So just wanted to put that out there.
Yeah.
Okay. I appreciate
Always ask your questions again. If somebody else say no, we'll keep going to the next person.
Yeah. So this person says, I'm a little uneasy about leaving a stranger in my home alone with the patient. I guess this is more of a trust issue. So I'm going to add to that. What kind of check do you all do on the person you're sending out to a home?
Well, we do all background checks on our caregivers. I believe it's 7 years. 7 years. And then we also do fingerprints as well. So to protect, you know, really just to make sure, because, you know, some people have children in their homes and things like that. And then you always can express, what are your preferences, right? Do you prefer a male or a female? I know, you know, or do you prefer to have your shift during the day, or, you know, because you feel more comfortable versus at night, when, you know, you're sleeping and you may feel, you know, just a little uncomfortable. So you always want to express your preferences to your home care agency so that, you know, it can be as comfortable as possible for you.
And you also can set up cameras too. That's something that I notice in a lot of my patients' homes. When I go in, I see the cameras set up around their loved ones, which is the nurses are 100% okay with. It stares right at them when you come in, so it's fine.
It's funny that you say that, because the next question was, are we allowed to video the home care provider in our home? And when I read that, I thought, well, that's a really good question. And I didn't know the answer. So you're saying yes. I didn't realize you could.
Yes, you can have video recording in their loved one's home. It could be around your house. That's fine, because it's your home. that we're entering. So there's no barriers or anything against that.
Right.
Okay.
And sometimes you don't even know the camera's there, so we wouldn't even know. So yeah, that's allowed.
Okay. Very good. Are there any other questions or comments? Okay, well, I'm gonna see if any pop in, if any come up, but I just wanted to thank you guys very much. And I will, to everybody out there, like I say, once I get the slide deck, the presentation, I will probably wait to send it out. And so what I do is after I finish recording this, we put it on our YouTube channel. And once I get that link, I'll send it at the same time as the slide deck. And I'll be honest with you, I always have to go to the young lady and say, how do you put this on the YouTube channel? So I will have to coordinate with someone who understands how to do that. So after that, and I wanted to tell y'all, and I wrote it down somewhere so I would not forget. And obviously I don't know where I wrote it down. So on August the 10th, our next webinar is by a gentleman by the name of Chris Wildman, and it is Medicare 101. So sort of just a quick synopsis of what Medicare is, what it can do, and all that stuff. Yep, August the 10th. There, I finally found my piece of paper. Okay, very good. So if I'm going to wait like one more minute, and if no one has any questions, if the Maxim team has any final comments, you are more than welcome to say. If not, we will, whoop, here's something. How many hours a week will insurance pay for?
It varies. It really just depends on what the doctor orders, right? And what that patient needs. So it really goes off of what the patient needs and then the doctor's order.
Right. And it depends on, right, like the service, right, that's being requested. So if we're talking about homemaker or home health aid services versus PDN or expanded hourly care, it depends on the payer too. Like that's a big one. Through, like we touched on in the table, through the VHA or Veterans Health Administration, for homemaker services or personal care, they have a case mix tool that they go by. So again, depending on diagnosis and what all's involved, the team typically will order a certain number of hours, and it can be anywhere from 3 up until 168. It just depends. And then for Virginia Medicaid, again, it just depends on the situation. They have a different like scoring tool that's used to determine how many hours someone would score for and what they qualify for. For personal care, it's typically up to 56 hours a week, speaking again for Virginia. And there is certain like exclusion criteria that can be met to possibly get more hours. And then for hourly care or expanded care, it's usually up to 112 hours. Depending on there's different managed care organizations or MCOs that one can be enrolled in. And with that, they can also potentially receive additional respite hours, which are supplemental. And that's an additional 480 hours per year on top of, say, the 112 per week. So again, sorry to be long-winded, but in short, it just depends on the situation.
Okay, very good. All right, we'll wait one more minute, see if anybody has a question that they're typing in. Do you all have any final words of wisdom for us?
I was just going to say thank you guys again for having us on. I really appreciate it. So thank you for coordinating this, Jerry, Taylor. I appreciate being a part of it.
Yeah, thank you guys. I always appreciate it. And for everybody listening, like I said, we've got the one on Medicare coming up, and I am always open for suggestions on what you all would like to hear in these webinars. So yeah, I appreciate anything. So thank you guys very much. Thank you to everybody out there. Please stay cool. This respiratory therapist is going to tell you the air quality is really lousy, so stay inside if you can. All right, y'all. Thank you very,
Thank
very
you guys.
much.
Thank you
Well,
Thank you,
everyone.
guys.
much.
Appreciate
Bye,
it.
y'all.
See ya.